Today's presentation will be a continuation of our previous webinar. We will continue to explore historical events that contribute to the complex issues that the Black community faces today. The lesser discussed consequences of the crack epidemic and the war on drugs, the national response to drug use throughout the years and updated opioid use and overdose death rates. We will explore 2 case studies of former clients and the impact of the war on drugs and benefits of implementing culturally adapted evidence-based practices and tips and tools to implement during your practice. During this section, we will review our first, review and recap our first presentation. During our first webinar, we discussed the importance of being aware and having an understanding of why mental health, mental illness, and addiction is so complex in Black Americans, and how historical events, as well as present disparities, continue to factor into the issues seen in the Black community today. The Great Migration saw a mass exodus of Black Americans leaving the Deep South. The primary cause of this migration was to escape racial segregation, violence, and discrimination. Another important factor was the mobilization of troops for World War I. Northern industrial cities experienced severe labor shortages, resulting in manufacturers recruiting Blacks and poor whites throughout the South. By 1919, an estimated 500,000 Black Americans had immigrated. Following the war, rapid demobilization of military without a plan of reabsorbing veterans into the job market led to unemployment and inflation and increased competition for jobs. This paired with fear, anger, and resentment by working class whites and European immigrants fueled the onslaught of violence in multiple towns and cities across America, and what is now known as the Red Summer of 1919. From late winter through early autumn of 1919, white supremacist terrorism was enacted in more than 3 dozen events. We will explore one of them today. The Elaine, Arkansas Massacre, September 30th, 1919. Stemming from a labor dispute between Black tenant farmers and sharecroppers and local whites, it is one of the worst racially motivated acts of violence in the 20th century. A mob of hundreds of whites from around the region was formed and randomly attacked and killed any Black person they encountered. An estimated 100 to 237 Black people were murdered and 5 white people. Evidence suggests that American military troops, as well as the white supremacy group, the Ku Klux Klan, worked together in the indiscriminate killings of African Americans in the area. A cover-up by the state government and a false story of Blacks inciting violence, in which local and national newspapers, including the New York Times, spread fear and hatred of Blacks across the country. When exploring these events, although difficult, it's important to highlight the history of relations between Black Americans and America. These events have lasting ramifications. Not only were Black lives lost in this violence, but millions of dollars in property was lost when homes and businesses were intentionally destroyed. 2 years later, in 1921, the infamous and now highly publicized Black Wall Street Massacre occurred. Minnesota, supposedly one of the most liberal states in the country, is not removed from instilling fear, danger, and violence to their Black citizens. Shortly after Blacks began migrating to northern cities, local, state, and eventually federal policies were put in place to prevent them from purchasing homes in middle or upper class white neighborhoods. As a result of these policies, Blacks were forced into rigidly segregated and impoverished neighborhoods, often termed urban or ghetto. An example of racial covenants is a Black family looking to purchase a home in a middle-class neighborhood, a home they can afford and are qualified to purchase, but are unable to because the language in the deed states that this property cannot be sold to Black Americans or any property in a particular neighborhood. The GI Bill. The purpose of the bill was to aid World War II vets returning to civilian life. As a Black man, if you were able to receive your benefits, banks and mortgage agencies refused to provide loans to you, making the GI Bill practically useless. For example, historian Ira Katz-Nelson wrote that in New York and New Jersey suburbs, 67,000 mortgages were insured by the GI Bill, but fewer than 100 were taken out by non-white buyers. But this occurred everywhere in America and not just on the East Coast. Both of my grandfathers fought in World War II, so this is not that long ago. This is the baby boomer generation. The GI Bill played an integral role in the creation of America's middle class. You know, the big house, white picket fence, 2.5 kids and a dog, you know, that good old dreams, that good old American dream slogan we all heard growing up. That came from this. These are real maps of Minneapolis and St. Paul showing how sections of the city were valued and determined who could live where. The map on the left shows the color code, blue and green were most desirable, yellow and red closest to the blackout areas, which were industrial. And this is where Blacks were forced to reside. This is redlining, a discriminatory practice in which the federal government systematically denies loans to residents in particular parts of the city, specifically where Black people were allowed to live. When loans were approved to Black buyers, the interest rate was significantly higher than they would be typically for white buyers. This increase in interest rate was not due to added risk to the bank, but because of race. Supermarkets, drugstores, and jobs were also deliberately and impractically located far away from residents, resulting in the redlining effect. The Federal Aid Highway Act of 1956 saw freeway systems built across America. What resulted from this was the deliberate placement of freeways through or over communities and neighborhoods, dismantling and displacing over 475,000 families and over 1 million Americans. Most were poverty-stricken and Black. And please direct your attention to the map on the right. The highlighted area on the left says Negroes, largest Negro section in the city. This was the Rondo community in St. Paul, Minnesota, a historically Black neighborhood where my family has resided since the 1950s. The community was destroyed when the I-94 highway system was constructed. The highlighted area on the right, the lower right, says slums and Mexicans. My grandmother is Mexican, 95 years old. This is where she resided when she was young. Over 3 decades ago, crack cocaine hit American streets. The most impoverished and disenfranchised parts of the city, specifically where Black and Latinos resided, were impacted the hardest. The federal government's response was a war on drugs campaign. Widespread addiction and the campaign devastated communities of color. These laws did not discriminate against drug users and drug dealers, but did discriminate on who was sent to treatment facilities and who was sent to prison. By 1993, over 1 million people had been arrested for drug abuse violations. 75% had been arrested for simple possession, over half of whom were Black and Latino. A 2012 report by the U.S. Sentencing Commission found that drug sentences for Black men were 13.1% longer than drug sentences for white men between 2007 and 2009. In 2011, research shows that prosecutors were twice as likely to pursue the mandatory minimum for Black Americans as for white Americans charged with the same offense. Discriminatory practices have also been documented in the medical field. There have been a multitude of studies suggesting that doctors and the medical field as a whole subscribe to racially biased ideals and beliefs towards Black people seeking pain relief. Other studies have found that pharmacies in poor but largely white neighborhoods were 55 times more likely as those in poor minority neighborhoods to have adequate supplies of opioids, making it difficult to obtain the necessary pain medication after surgery. Regarding access to medication for opioid use disorder, we once again see stark disparities in communities of color. Blacks are less likely to receive buprenorphine and more likely to receive methadone. But this creates several issues with access. Methadone treatment is often more restrictive, making it difficult to hold a job. Over-reliance on methadone for uninsured and publicly insured patients who are disproportionately Black in urban settings may preclude individuals from accessing one of the other approved medications that could be more effective for them. Access to treatment options is more dependent on race, income, geography, and insurance status, rather than individual preference or medical or psychiatric indicators. Part 2, additional consequences of the war on drugs campaign. Typically, when exploring the war on drugs and the ramifications seen in today's society, discussions typically revolve around the crack epidemic and mass incarceration, both detrimental to Black and Latino communities. One less examined consequence that has done considerable harm to communities of color is how child protection services and the foster care system interacted with Black and Latino families during the war on drugs campaign. The current opioid crisis has highlighted how foster care systems interact with families when there are allegations of parental substance use. Characterized by gross misinformation on the nature of substance use, the punitive legal processes that more times than not resemble the criminal justice system, and race and class disparities seen in these systems further compound the issue. It is claimed by state foster care and the media that since 2012, the increase in number of cases and actual removal of children is due to an increase in drug use by the parents. Like many who have been subjected to the criminal justice system, supervision and control, parents and children entangled in the foster care system are almost always low income and disproportionately Black, Native American, and Latino. But removing children from their homes in response to a drug epidemic is not unprecedented. We have seen this before. In the 1980s and 1990s, when poor and disenfranchised communities were ravaged by crack cocaine, the United States ramped up its war on drugs effort. And almost in unison, the foster care system saw dramatic increases in their population. This is a core component in the legacy of the war on drugs that often goes unnoticed and rarely discussed. During the height of the cocaine epidemic, the number of children in foster care rose dramatically, from 400,000 in 1990 to an all-time high of 567,000 in 1999. Specifically, according to a 1999 U.S. Census, Black children accounted for only 15% of all children under the age of 18, accounted for 30% of children entering foster care, and 42% living in foster care. Finally, in 2012, the numbers dropped to a historic low of 397,000. That was more than 25 years after the crack epidemic that was sensationalized by the national media. For far too many children, a system that was supposed to be a temporary safe haven became their permanent childhood. Those traumatic years in foster care were met with more trauma and hardship for thousands who aged out of the system at age 18 to begin adulthood without a place of belonging and without the confidence, support, and resources to navigate the real world. Paired with the added potential for anxiety, depression, and other emotional and cognitive difficulties stemming from their traumatic experiences, these children often go into adulthood struggling with substance abuse themselves, entering into a vicious and perpetuating cycle that persists throughout generations. An example of this is seen in a study conducted in 2006 in one state's foster care system, where 17-year-old youth were interviewed. The study found that 45% of foster care youth reported using alcohol or illicit drugs within a 6-month time span prior to the interview, and 35% met criteria for substance use disorder. Having a diagnosis of conduct disorder and or living in an independent living situation significantly increased the likelihood of current and lifetime substance use and disorder. And as a reference, Black youths are two times more likely to be diagnosed with conduct disorder than their counterparts. In the drug war raged by the criminal justice system, the federal government poured unprecedented funds into expanding the ability of law enforcement and corrections to target people accused of using and selling drugs, utilizing the prison and jail system as a tool to curb the drug issue. There was no remotely comparable federal or state effort to invest in healthcare, job programs, housing, childcare, or any evidence-based and culturally relevant drug treatment programs that would have aided these families while also while also reducing the harm of drug use and drug sales in their community. In the drug war raged by the foster system, the government responded in kind by allotting unprecedented amounts of funding into reimbursing states for the cost of removing children from their parents. Again, largely Black, Latino, Native American, and white children living in poverty. Case study number 1. In this case study, I will unpack a situation with a family I once worked with and their experience with the foster care system. I met the family in 2008 while working as a case manager in a Hennepin County-funded North Minneapolis middle and high school truancy diversion program. And the students I worked with were primarily Black, Latino, and Native American. I met the family during a school intervention meeting. As a case manager, I spent several months primarily working with the student, advocating for him at his school, and working with the school psychologist. As with all the students I worked with, poverty and lack of resources were a major issue in their lives, and extensive family support was required. Throughout the first few months of working with the student, I discovered that his 2 older siblings were taken from their home. As the professional relationship increased, the mother began divulging information around her child protection case. The mother explained that in 2005, she called the police multiple times on her then partner pertaining to a domestic dispute. She explained regretting calling the police and referenced conversations she had with her mother, expressing concern about calling law enforcement, stating that police involvement would only make matters worse. The final time she contacted law enforcement, her partner was arrested and she was questioned. They asked multiple questions regarding her capacity to care for her children. They asked about her drug use. She explained that she drank occasionally and smoked marijuana infrequently. Several weeks later, she received a phone call from Child Protection Services stating that her living situation may not be suitable for children. The mother was taken to court, found guilty of neglect, and her 2 children were eventually taken from her and placed in foster care. Part 3. National response to drug use throughout the years. And I'm going to pass this to Ian. Joe, if you can aid me in doing that.
What are you trying to do, Joseph?
Pass the controls to Ian. Oh, here we go. Sorry about that. There you go.
Cool. Thank you so much, Joseph. Nice work. So I think it will be important to always keep in mind a very important frame of reference here when we're talking about substance use patterns. How do I go back? Okay. I think it's, and when we're talking about issues of policy, treatment, the science and study of drug use, and the work that we do as counselors and therapists. And that is, humans have been ingesting substances, psychoactive substances, for the purpose of getting high and feeling good, or participating in rituals and religious practices, perhaps since the dawn of our species, right? Maybe even before that. We do know, we have hard evidence over 10,000 years old that humans have been ingesting substances for the purpose of getting high, which is to say that getting high is an innately, intrinsically human endeavor, okay? And it really wasn't until much more recently that governments sought to impose legal rules around this practice, this very human practice, okay? Certainly there are references in certain religious texts and religious societies that might have outlawed the use of certain substances. But beyond that, humans have been mostly free to pursue this act of intoxication and exploration. Since the dawn of human civilization, up until just about, a little over 200 years ago. And that is such an important point that I think we all lose sight of because of how incredibly, how much effort and intention has been put over the years to criminalize drug use, to stigmatize substance use, and to create really complicated regulation onto the access and consumption of substances. And so with that in mind, I think it would be helpful to just kind of tick off what are some of the major events that have occurred in the history of drug use. And so, you will probably very quickly see that that there is one thread that seems to tie all of this together, okay? And so in the 1800s in the US, there was an influx of Chinese laborers, Chinese immigrants who came and famously built the railroads across this nation of ours, right? And there was a high concentration of Chinese immigrants in San Francisco. And with them, these Chinese immigrants brought along various cultural practices, one of which was the consumption of opium, smoking opium, and the practice of smoking opium inside of an opium den. And at first, it wasn't really remarked upon all that much until, and there's an interesting criticism of this practice. So it wasn't until about 1875 when a wave of anti-Chinese anger spread across the country, and in particular in San Francisco, that the first drug law on the books in the United States was passed. It was a local ordinance in San Francisco, and some have commented that that there at this time was an undertone of sexual fear on the part of lawmakers, and the idea that a white woman would be seduced into smoking opium inside of an opium den, and then would have sex with men inside the opium den was too threatening. And so then in 1909, the US government fully banned the import of opium and its derivatives into the US. Notably, this did not include the opium that was cultivated here. It was just the import of opium. And then in 1914, the Harrison Narcotics Act was passed, and this was a major federal drug law. It still kind of sets the framework for U.S. drug policy today, and it included laws against cocaine use. What was happening around that time? Well, cocaine was medicinal, right? And it was used by professionals and stay-at-home moms and dentists, right? It also was added to Coca-Cola, and at first the Coca-Cola was primarily dispensed inside of pharmacies, right? And so you'd go to the soda counter and could drink Coca-Cola. Well, when they started to bottle and sell it widely, it was more easily accessed by Black Americans. And it wasn't long before tales of quote unquote drug crazed Black men who were impervious to bullets started to get passed around, and Black users of cocaine became demonized and associated directly with Coca-Cola and cocaine consumption. And that helped to spur the passage of the Harrison Narcotics Act. In the 30s, there was a wave of Mexican workers, in particular in the Southwest of the United States, and a moral panic spread across the country that demonized the use of marijuana and cannabis, thanks in large part to its intentional association by the media and government officials with Mexican immigrants. Henry Anslinger, who was the commissioner of the US Narcotics Bureau at the time, helped to secure passage of cannabis laws in 46 states. And then we saw kind of a wholesale shift in the 50s and 60s, not just of drug policy, but on this notion of tough on crime. And you might also recall that one of the major domestic events that was happening in the 50s and 60s was the civil rights movement. But nevertheless, Nixon famously declares the war on drugs in 1971 and really increases funding and efforts toward the DEA and other enforcement agencies. Also created the schedule, the Controlled Substances Act, that created the DEA schedule that we still use today. In the 80s, Reagan supercharged the war on drugs. There was some movement in the 70s away from viewing drug use as a criminal justice issue and more of a public health issue. Well, Reagan saw that was thrown out the window. And when the crack epidemic was raging, that was a great scapegoat and source of fear and moral panic that politicians used to further this narrative. And then in the 90s, the Clinton crime bill built upon a lot of those earlier laws and measures, and we saw this massive spike in incarceration. Of note, the discrepancy that viewed crack as somehow far more dangerous and deadly than powder cocaine, actually enshrined in law, 100-to-1 discrepancy. That was rolled back in 2010, but still there's still a discrepancy. It's just been reduced. So as you see, the rate of incarcerated Americans just spirals out of control. Felons and felony rates spike. And if these laws were going to support their stated aims, we would maybe have seen drug use disorders and overdose deaths drop, but instead, along with criminalization, we've seen death rates soar. And it's not like drug use is going down. If anything, it's largely stayed stable over much of time. And so this is nothing new. This is something that has been shaping media narratives for hundreds of years now. It's being seen in the current way that the opioid epidemic and opioid overdose epidemic is being framed, which is a far cry from how these issues are framed when the drug use is associated with a certain racial group. And so, we talk a little bit about, how did drug use get so associated with race? And that really has a lot of implications for how we think about the future. How do we think about the concept of legalization? And I hope that we can all keep that in mind as we continue this conversation. Back to you, Joseph.
Thank you. Okay, and now we will review some of the most recent opioid overdose data. In Minnesota, African Americans make up 7% of the total population, and Native Americans make up 1.5% of the total population. While Minnesota has one of the lowest drug overdose mortality rates in the nation, Minnesota has also some of the worst race rate disparities in drug overdose mortality in the nation. Since 2015, Minnesota has ranked in the top 3 in the country in race disparity of deaths among African Americans relative to whites. In 2018, we ranked 2nd. In 2019, African American Minnesotans were more than twice as likely to die from drug overdoses as white Minnesotans. Similarly, in 2019, Native American Minnesotans were 7 times more likely to die from a drug overdose than white Minnesotans. Other states have disparities based on race. However, the rate disparity between Native Americans and whites is the greatest rate disparity based on race in the United States. And there's not much data available as of yet from 2020 and how COVID-19 has impacted the overdose death rate. In Philadelphia, COVID-19 was associated with increases in opioid overdose deaths among non-Hispanic Black individuals, but decreases among non-Hispanic white individuals. COVID-19 has exacerbated pre-existing stressors, social isolation, and economic deprivation disproportionately in Black communities, possibly contributing to the increase in substance use. The pre-existing racial disparities in accessing substance use treatment may also have been heightened by COVID-19 related shifts in treatment availability. From June 2019 to June 2020, Black people had a 52% increase in overdose death rates, compared to white individuals who had a 24% decrease. From February 2020, when COVID hit many cities, to June 2020, there was a 60% increase and a 22% decrease. Case study number 2. The client was referred to my employer and enrolled into the program I run called the African American Men's Project, or AMP. The AMP program works specifically with Black men in Hennepin County, helping them gain employment and housing, as well as empowerment groups that focus on healthy manhood, improving mental health, healing from trauma, and instilling a sense of self-esteem and self-reliance. The client struggles with mental illness are anxiety primarily, depression, suicide ideation, and PTSD. The high school he attended was primarily white. He had been bullied, called the N-word repeatedly, made fun of for the size of his nose, called a crack baby, and teased about his tattered clothes. Growing up, his parents were addicted to crack cocaine. And although his parents were using drugs, they both worked jobs. As a consequence, they were rarely home. Not only were his parents using, but his aunts, uncles, and other family members were using as well. This has instilled a fear in him that he will one day succumb to addiction himself. He recalled one of his grade school teachers coming to his home to use drugs with his parents. His upbringing as a child and early adult made him feel that he wasn't deserving of love and happiness. He felt like there was no way out of his status in life. At this time, he became suicidal. He explained that he had no guidance and no stability, and he was pretty much raising himself. And due to this, and the lack of emotional connection with anyone in his family, he went into the streets searching for a sense of belonging. And at this time, he was recruited by gangs. He recalled during this time that he felt like he didn't know who he was, and that he didn't have a sense of identity. I asked him, growing up during the crack epidemic, how did you feel, and how did you navigate the world? He explained to me that there was no thinking past the present time. Doing so would get you killed. Taking it day by day and even moment by moment was the only way to survive. During this time, several of his friends and family members were murdered or passed away due to their drug use, which increased his belief that there was no hope for the future. The client expressed that finding God and becoming spiritual saved his life. I asked him now that he is an adult and after enduring this trauma and educating himself on systemic racism and having a better understanding of why things were so bad in the Black community during that time, what has he done differently so his adult daughter wouldn't face the same experiences that he faced when he was growing up? And he explained to me that he wanted to make sure and be intentional in letting her know that she was loved, wanted to keep her busy in sports and other activities, and in order to keep her off the streets. Between 2018 and 2019, he worked with a therapist for about a year. He explained that his therapist never attempted to get to know him, never tried to form a connection with him. He felt that his therapist would talk at him and not to him. For every question he had, the response was a doctor's answer and not a human answer, he said. He felt like he didn't care about his issues. He explained that he had enormous amounts of anxiety and wasn't close with any of his family members and didn't have anyone to talk to, and was looking to his therapist for a sense of connection. He stated that his therapist would ask him to go home and write down possible solutions that might make him feel better. He expressed that it was hard enough expressing his feelings expressing his feelings and digging deep and sharing his soul to a stranger, let alone to a white therapist. He explained that he understood that as a white therapist, he had no idea what he was going through as a Black man. But he thought that him being a therapist, he would be more compassionate and mindful of his trauma. And the client stated that he just wanted the therapist to empathize with him a little bit more. He wanted more of a back and forth interaction with the therapist, being able to build on previous conversations and previous sessions, and not just, and I'm quoting my client, okay, I think I've heard enough, I'm going to prescribe you medication. He quit going. Shortly after that, he enrolled into my program. Overall, he feels that with his parents' addiction and how the world views Black people, the trauma that he endured as a Black man in America during this time could never be undone. Feels like his life was forfeited, that he passed down the crack gene to his daughter. He believes that he is a descendant of the crack epidemic, and that this trauma will be with him for the rest of his life. As we have previously discussed, Black Americans, Latinos, and Hispanic Americans, and Native Americans have endured decades, if not generations, of trauma in America. Prejudice, discrimination, poverty, and other factors bring about feelings of unworthiness, insignificance, and indignity, making it difficult to construct positive self-images that support resilience and empowerment. And as a consequence of systemic racism, scholars note that Black and Hispanic individuals may come to accept the negative societal beliefs and stereotypes about themselves and their group. By focusing solely on individual psychological factors, the use of a non-culturally adapted evidence-based practice may ignore or minimize shared values, stigmatize identities, and contextual factors, for example, socioeconomic status and systemic forms of discrimination, contributing to substance use in Black and Hispanic individuals. For example, cognitive behavior therapy, which I'm quite fond of, may minimize or ignore realistic environmental factors by focusing solely on changing cognitions and behaviors, which may intensify ethno-racial minority clients' psychological distress. Because CBT focuses on the individual as an agent for change, it typically does not address the effects of prejudice and discrimination on individuals, families, and their community. Several studies indicate that culturally adapted mental health interventions have an overall positive effect, and that culturally adapted mental health interventions may be more effective when these adaptations are specific or targeted to a particular racial or ethnic group. One study found that participants in a culturally adapted form of group cognitive behavior therapy had a lower dropout rate and greater improvement in symptoms and functioning than participants in a non-adapted CBT group. And finally, some tips that may be beneficial when working with Black clients. Anyone want to start us off?
Yeah, sure. So it's important. So we thought it'd be helpful to include some strategies for practitioners, especially folks like me, white practitioners that are working with people of color, so that you can leave this talk with something tangible, something to use. And so, the first item is be mindful when speaking with Black mothers about their substance use. We already know that the foster care and CPS system is chock full of examples of ways that it has been used inappropriately against Black and brown mothers. And so if you are if you're demanding honesty at all costs from the clients that you're working with, remember that there might be a high cost to that honesty. And so keep in mind the second point, that we as mental health professionals have to earn the trust of the people that we work with, right? I think one of the things that Joseph identified in the case study was it almost seemed as if the white therapist took that trust for granted and did not spend enough time, setting aside the protocol, if you're able to, right? Unless you're conducting a study of some kind, setting aside the worksheets and the protocols, and spending more time than you otherwise would building rapport and building trust. Do you want to speak on that at all, Joseph?
Sure. I know it's important, obviously, when first being introduced in the initial session with a client, obviously it's important that the client, that you ensure that the client is stable. But if your agency allows, the assessments and other paperwork and questionnaires and things like that could possibly be pushed to the side for a second, because again, it's as Ian stated, it's important that the conversation that the client begins to feel comfortable with you. Developing a rapport with black clients is difficult because there's so much mistrust or distrust within the medical field, as well as government in general. Just anyone in power is a potential risk. And as we've seen in our previous webinar, as well as this one, when it comes to agencies in power, oftentimes than not, there's harm that gets done, and it's important that we realize that. Listening to their story and understanding their individual and cultural experience. Ask questions about what it means for them to be Black in America. I think it's important that we have we kind of drop all of our bias or our pride and just ask questions about how does it feel to be a Black man in America or a Black woman in America? What things have you gone through that I haven't gone through, so I can understand some of the stressors that are involved in your life?
Yeah.
Oh, sorry, go ahead.
Yeah, and I think as being white, and I think even being Minnesotan, where we are often afraid of confrontation, or we can shy away from potentially difficult subjects, even as therapists, right? And so don't be afraid to bring this up and to explore it with your clients.
I think it's important to note that the Black community, and I'm generalizing, but the Black community is, we're people who want to talk and express ourselves more so than having, answering questions and things like that. That's uncomfortable. I think that goes into, learning and listening and understanding the experience of the person that's in front of you. There's extensive trauma seen in the Black community. Obviously, we've gone over that. PTSD specifically is underdiagnosed, particularly in Black men. This is something that I touched on in the case study, the second case study, where as a Black man, particularly ones who are living in poverty and growing up in the inner city, it's showing emotion could get you hurt. You have to put on this. You got to put on this face, this suit of armor in order to protect yourself out in the streets. And that's something that if you don't know, or if you're not associated with, the Black community, you're not really going to understand. And it's important that we try to uncover and unpack the stressors that the client is showing. PTSD, anxiety, things like that aren't missed. I recall reading an article that was discussing psychiatric disorders being in Black Americans being diagnosed at a significantly higher rate than everyone else. And they did not actually have a diagnosis of some sort of psychiatric disorder. This article was discussing schizophrenia. It's just that people were misassociation or misunderstanding the trauma and paranoia of being Black as a psychiatric indicator. And it's important that we don't, get these things confused.
Absolutely. And again, refraining from viewing resistance or lack of disclosure as a red flag, but instead an indication that you've got more work to do to build trust and to foster an environment where real work and healing can take place.
And we touched on this a little bit earlier, but refrain from using worksheets or homework until you have established the working reliance or the therapeutic alliance with the client. Again, this is really important of having conversational sessions with the client in order to build that trust. This is, this may be a cultural thing, or this may be, Latinos, Native Americans may also feel the same way, but I know specifically in the Black community and in the work that I've done, as well as the Black men that I work with, these things aren't happening when they work with therapists. The first thing that happens, obviously, the assessments to assess the stability and safety of the client, but then after that, it's important that you put the paper away and just have a conversation with the client in order to build that trust.
And that last point, I think, too, is important, right? I think that there can be an over-reliance on the practice of self-disclosure of one's own addiction history. I mean, I think in general that many of us can be guilty of that, but especially when working to gain trust and rapport, we can't just assume that, hey, like I'm in recovery too, we must see eye to eye. No, that might be helpful, but there's often a lot more work that would be required to foster that environment of trust and authenticity.
Thank you very much.